Hello, good evening. My name is Torben Dalstra, and I am recording live today from my office here at the Fire Station 35 in Colorado. And I am going to be giving a presentation on my quality improvement project, which was basically the implementation of an oxygen treatment protocol at Peak Medevac, where I work as a flight nurse part-time. A little bit of background. Obviously, as a flight nurse, it's my responsibility to keep patients safe and comfortable, provide excellent patient care. Peak currently does not have a oxygen treatment protocol. It's up to the provider whether to provide oxygen or not. And I truly believe that all patients would benefit from a low dose of oxygen. This really assists with pain, anxiety, and the physiological effects of flight. This treatment is actually backed up by current literature. I found a lot of great literature out of GEMS. Oxygen obviously helps with hypoxia. Something that we're worried about in the flight environment is partial pressure issues due to the increase in altitude, and then obviously patients with respiratory compromise. It's also backed up by the FAA. There's a lot of differences between a standard hospital environment and the back of a Learjet or the back of an ambulance. There's a lot of things going on. Not only do we have to worry about altitude, but there's a lot of stressors, noise, vibration, limited space, and then motion of the aircraft. The ACCT also endorses the use of oxygen. We want to obviously provide for comfort, pain relief, and emotional support. It's a very scary environment, especially if you're not used to flying. And so we want to alleviate those as much as we can. So my aim statement was obviously improve patient outcomes and customer satisfaction with the use of an oxygen treatment protocol. I wanted to statistically prove that the implementation of this protocol improves both. It improves my outcome as well as customer satisfaction. And then my goal is to permanently implement an oxygen treatment protocol at Peak Medevac. My process analysis, I used the cause and effect diagram. This was one of our exercises. I thought this was a great way to come up with what I was going to do and how I was going to do it as far as my actual project. The plan changed, what I did. So basically what I did was I gave oxygen to every patient I transported. I monitored the oxygen saturation and maintained it between 94 and 99%. Didn't want to get closer to 100, obviously, to avoid oxygen toxicity. And then I had each patient complete a survey at the end of the transport, and then I cataloged and evaluated the results. Here's a survey. It was 4 basic questions and it was on a scale of 1 to 10. And so I predicted that the oxygen treatment on every patient would be a positive effect. It would assist with hypoxia and obviously combat those stressors associated with flight. And my results were pretty interesting. I had 2 cycles. I transported 4 patients the first cycle. And like I said, the scale was between 4 and 40 points. The median score was 22. My goal was to maintain a score of 28. First patient I scored 32, 26, a 28, and a 35. On the second cycle, I transported 3 patients, and they scored a 30, 36, a 32, and a 30. Cycle 2, I did kind of have some minor issues. The plane was down for a few days due to maintenance. This was an unfortunate setback, but I really don't think it affected my data too much. Every patient did seem to appreciate the oxygen. So my summary, it was interesting to kind of see what happened with these 7 patients. I was able to obtain good data. The scores were a lot higher than anticipated. They were all above 22, which was the median. 2 of the scores were right at or just above my goal score, but these patients weren't in pain, so they had a lower score. But the intervention did seem to help most patients. Here's my run chart. Statistically shows my scores on a graph. So what did I learn? Like I said, this was a valuable learning experience. I was able to incorporate many of the lessons from this program and this course. I implemented the scientific method and evaluated my research. Most of my patients were very responsive. They seemed to respond positively to the intervention, and they scored appropriately. The impact on the system, I hope it's going to have a major impact at Peak Medevac. I'm going to present this information to the administration there, Robert Higginson, who is the director of operations as well as our medical director. And I hope that they decide to implement this protocol permanently. And like I said, the literature does support my findings. So in conclusion, this was a valuable experience. I really did learn a lot. It was great to incorporate many of the things that we learned, and not only this course, but throughout the program, throughout the year. I was able to implement the scientific method, the PDSA model. And like I said, I really think that this protocol can have a positive impact on patients in the flight environment. We see people on some of the scariest moments of their life. They're very anxious. They're very scared. And if we can do anything to alleviate those, I think we should do so. I just think that's good patient care. A couple things I thought about in this process. I think a better picture could be drawn with more data. A 6-month or 12-month longitudinal study, I think, would be a great way to incorporate, just kind of get a better picture of my results. And then obviously I did think about that maybe the oxygen was creating kind of a placebo effect. The fact that we're doing something might make them feel like as if it's really helping when it might not be as helping physiologically as much. But like I said, if we can do anything to make them a little bit more comfortable, I think we should be doing that. It's just about providing sound patient care. And then here is my actual written protocol, which I'm going to present, like I said, to the administration, and I hope that is implemented on a daily basis at Peak. And here are my professional references. Once again, I really appreciate your time. It was a great, valuable learning experience, and I hope you guys have a fantastic evening.